Folks, part two of talking about this conspiracy theory I keep hearing that doctors and hospitals are paid to label people as having died from COVID on their death certificates, and therefore COVID deaths from hospitals are overinflated. So in my last post, I talked about what actually goes into filling out a death certificate and when we count a death as COVID versus not COVID. But let's talk a little bit about this question of, are people being paid to actually write this? So let's start with Canada. In Canada, there's absolutely no link between remuneration and the cause of death of somebody in hospitals. Hospitals get a global annual budget to work from, and it doesn't matter what people in that hospital actually die from. There was a movement to link payment to chronic diseases that are managed by the hospital and or procedures, but that movement never actually included COVID-19, and it hasn't been broadly implemented. So in Canada, there's absolutely no relationship there, and there's no motivation to write COVID on the death certificate. Now, in the US, there is a payment per COVID patient, but that payment threshold was set to match the payment that they would have received from any other serious respiratory infection or inflammation, a certain amount for patients who were simply on the ward with that disease, and a different higher amount for people who were in the ICU and on a ventilator, again, to match what they would have received for other similar diseases. So that income was basically replacing the income or the amount that they would have received for serious infections like, for example, the flu. Now, there is a 20% Medicare bonus for COVID patients, but that was really put into place to keep hospitals afloat because hospitals were suffering so much revenue loss from the loss of routine appointments, routine procedures, and surgeries. And the last point is that it's just not a trivial thing to upcode your admissions and your deaths. In fact, hospitals would face a huge civil and criminal liability if they did that. And the biggest thing is that they would actually risk being kicked out of Medicare, and no hospital would take that risk for a 20% bonus. So in Canada, clinicians and hospitals have absolutely no motivation to upcode patients and write COVID on their death certificates. And in the US, the dangers of doing that would just never justify that small extra bonus that hospitals would get. So this is a conspiracy theory that just doesn't hold water.